My name is Adam Burdorf, and I'm originally from northern Iowa, a small town that no one's ever heard of, Armstrong, Iowa. And following high school, I went to college at Iowa State University, and then medical school in Des Moines, and then traveled west here to Omaha for internal medicine training, cardiology, and then heart failure transplant. With cardiology, I get to apply imaging, procedures, taking care of patients in the clinic or critically ill patients in the hospital. And all of those in combination really made me pursue a career in cardiology and eventually in transplant cardiology. My practice mainly focuses on treating patients who have end-stage heart failure from whatever cause, whether it be from a history of heart attacks or valvular heart disease. We also take care of patients with various genetic causes of heart failure, as well as pulmonary hypertension. When a patient's referred to me, they've usually had a long-standing history of heart failure. And so a lot of times they're looking for answers, looking for hope maybe even. So it's an honor for me that they've chosen to come to Nebraska Medicine. And I know that I'm a representation of Nebraska Medicine. So it's an honor for me to take care of them. And that first visit, I'm there to listen to their story. My background in internal medicine kind of makes me a detective, so I like to put together the pieces, what's happened to them in the past, in order to really understand the patient. And then from there, it's my job to educate them on their disease process and provide them options that maybe they didn't know about that they had available to them. I was exposed to medicine at a young age. Unfortunately, my father was sick when I was young. And so being in close proximity to the Mayo Clinic, I was exposed to medicine at a young age, and not even necessarily the practice of medicine, but the history and seeing doctors walk around in white coats, and I became intrigued at that point. And then through high school and then in college again, I fell in love with science, and then being able to apply science in order to help people and take care of patients is what really attracted me to medicine. Quickly on in my medical career, I learned that I enjoyed teaching and academics to help kind of push the boundaries of medicine to make those discoveries to help our patients. So I quickly learned after I started my residency that I wanted a place in academics. And so those combinations together really made Nebraska Medicine an ideal place for me.